feel free.
Hello, good evening, everyone. Thank you for joining us today on our first session on Introduction to the Academic Foundation Program. My name is Wani and I'm the president of DRUMS. And today I'm delighted to introduce to you Dr. Fergus Taylor, who is an academic foundation doctor due to take his rotation next year, April, in research. Dr. Taylor trained in medicine at the University of Glasgow in his strong interest in plastics and global surgery. To take note, the question and answer section has been enabled. Just a few things to take note. Section has been enabled and you can ask your questions there. Dr. Taylor will first do his talk and we can get to questions after the talk. So please feel free to ask your questions and ask as many as you can. Yep, so without further ado, I'm gonna let Dr. Taylor take it away.
Cool. Hi there, can you hear me okay, everyone?
Yep.
Brilliant. Well, I'll get started on the slides then. I've just put up the timetable for now, just to kind of highlight that this is the first of a couple of sessions over the course of really the next couple of months for the first two, but then there'll be a few extra events kind of later on in the year. After winter, after the actual AFP cycle has kind of calmed down for a bit. But initially, well, this lecture in particular is really just an introduction to AFP, a bit of background about it, and kind of a bit more information to help you get a sense of if this is something that would appeal to you, the pros and benefits. Pros and cons of it. In a week's time, a couple of my colleagues, some of the academic FY1s, we're going to talk through how to build an AFP portfolio. That might not initially make sense, but I'll kind of explain what that is a bit later. And then the week after that, there's another, I think there's a couple of the same people and a couple of the new FY1s and some of the academic FY2s will talk through the actual interview process itself. Might be a bit of a funny year this year, admittedly, because the interview process might be slightly different and a bit more akin to what we're doing just now, but they can talk through the kind of principles and how you would support yourself as a candidate kind of going forward for that, if that was something that appeals. So as I say, this is a bit of a background about the academic foundation program, and really from my experience as applying as an FY2 2 years ago. So who am I? Well, I'm FY2. I studied in Glasgow. I'm part of the academic programme in Scotland, in that I applied to Scotland and then ranked my choices within it. So I work in the Southeast programme. No, sorry, I work in the East programme, which is Dundee. But there's also programmes in the Southeast, which is Edinburgh, West, which is Glasgow, and the North is Aberdeen and Inverness. So I wanted to kind of put this slide in early on. These are both pictures from my electives at university to kind of highlight that actually AFP kind of relates to a broader range of activities, and actually the reasons why I got into AFP probably relate to projects that didn't necessarily come from my university library. They came from interesting electives and SSCs and experiences on different departments around the world. In particular, there's one in Cambodia where I was working in a pediatric, I say working, I was a student, I was studying in a reconstructive pediatric center. It was quite interesting because it was organized as a charity, but also from a kind of purely surgical perspective. It was really interesting in terms of the caseload there, and certainly the stuff I saw there really gave me a love for plastics and surgery as well, is why I've applied to the program I'm on just now. Rwanda on the right there was another elective. I was very lucky in that I managed to get funding for both of them to go away during my time in undergraduate, and that as well was working in quite an interesting health setting that gave me a bit of perspective and gave me a bit of a background in some settings and working with some groups that kind of engendered a love of research and some of the projects which helped me apply to AFP later on. So it's a bit more of this and a bit less of this. If you don't know what that is, that's the University of Glasgow library, which is a very sad place, but very worthwhile, but not what AFP is about. So this, you might be watching this from a range of backgrounds, so I'm gonna sort of dumb it down and then kind of build it up from there. The foundation program is the 2 years after you graduate. So the first year, where you're a kind of prior to full registration, you've got your provisional registration with the GMC as an FY1, and then FY2. Again, those 2 years are about combined medical, surgical, and specialty training to meet a range of core competencies and to kind of meet a national curriculum around what you need to learn to apply to further training, to apply to the kind of core medical, core surgical, all the other training programs around that. So that's your first 2 years. Now, what AFP is the exact same thing. You have to do all the same things as you would as an FY1 or FY2 in the regular training program, but it's some extra opportunities which are linked to a university based in wherever it is you might be doing it in the UK, and what that actually means varies by the location. And I'll get a bit more into that in a little bit. So I put this up for a bit more perspective. There's a map here on the right, which is all the different units of application actually for the regular foundation program. However, I think it maps fairly well to the kind of geographical locations you'd use for the academic program as well. So I think there's 20 places in there on the right for where you would apply. So for the regular program, you would apply to Scotland, for example, or Wales, Northern Ireland, or a bunch of places in England. And it's the same sort of process with the academic program. So there's 2 stages. All of this comes before you would apply to your regular foundation program, and you'd have to do that regardless of whether you're successful or not. You create an application, which is it's on this website online called Oriel. It's very, it's a template that everyone follows. There are white space questions, which are kind of broad questions around a particular topic that you get to talk about for, I know, 300 words or whatever the character limit is now. And then there'd be different sections on things that you've done in the past to kind of present as your portfolio. So previous degrees, previous presentations, previous prizes, things like that you can put a bit of detail in. Now, based on that, you would get a score, and then you would be potentially invited to an interview. And previously, obviously, those were done in person in a range of different settings. And you would kind of go through the components of your portfolio, and then you would be asked different questions on academia as well as just general medicine, because you'll have questions on how to function as an FY1. They want to know that your clinical knowledge is good as well. And taking all of that together, you might be offered a place on an academic program. So you'd rank all your options before then, and you might get a lovely email offering you this particular job. So all of that is to say that this is something that you can apply to prior to your regular foundation program, and it doesn't affect anything by going for it and not getting it. Let's put it that way. So a bit about Scotland. I could talk about lots of the different areas where AFP is based. However, I assume lots of you are probably more, if you have any prior knowledge, it's probably based around Scotland. So Scotland would be one area that you would apply to. So I applied to Scotland as a unit of application. I could apply to a second area as well for for AFP, so I could apply to Wales, is what I did. You could apply to London, you could apply to a number of places in England, but you can have 2 of these places, and there's 15 areas all around the UK that kind of make it up. So within Scotland, there's these 4 different areas where you kind of broadly cut the country into pieces. I'm this lovely little teal bit up in the middle there, around Tayside. That's normally based around Dundee and Perth, probably more Dundee than Perth itself, because it's based with the University of Dundee. In dark blue, that's Aberdeen and Inverness. The programs themselves might be based more in one area than the other, or you might be rotating around a number of places. Green there would be around Glasgow, and that's predominantly around Glasgow itself, and obviously the southeast as well as Edinburgh, and again that's probably based around Edinburgh and some rotations in the borders, so things like that. So those were the sorts of jobs you might be applying to. And I put up a bit of that as kind of backgrounds to it. I've put some links in here which you'll be able to access after this thing has gone out. There are a number of different places. Those are the first couple, just so you can get an idea around the number of jobs in each and how that might be structured, because there'll be different types of jobs that might be based more around academia in the sense of kind of academic research, or they might be based around medical education or leadership. There are kind of broad domains which are interesting to the interview and to applying, that jobs might be kind of aligned around. There are a different number of places in each. Obviously, different numbers of people apply to each place. They might appeal for different reasons or not. You can probably look up how many people have applied to each job in the past. I wouldn't recommend it, obviously. Just apply to a place that you'd like to go to, rather than trying to game the system, maybe. This is the most important question, I guess. There is this option that you can do AFP instead of the regular foundation program. Why is it worth doing it? Well, the academic program is everything that you're going to be doing already, but it has extra bits and pieces that might be helpful, that might be interesting, that might be useful to you in your further career. It has, and this depends where you're going, it will vary from place to place, because different universities will have different interests and have different opportunities, but there'll be opportunities based around research. You might be able to be based in a particular lab. You might be able to kind of follow a unit. There might be teaching opportunities. Almost certainly there'll be opportunities based through the university that is partnered with, because that university will probably be a medical school. So you can do some undergraduate teaching, is one of many things that you could be teaching on. There might be leadership. Medical leadership is a concept in medicine about how well we can work as teams, and there's lots of really useful opportunities that you can take part in an AFP. The middle thing there is a particular specialty. So when you're applying to these jobs, you might be able to see all your jobs for F1 and F2. I could when I was applying to Dundee. When I was kind of ranking my jobs, certain places in Scotland, I could only apply. I could only see what I'd be doing for the first year, and then I'd apply slightly later on. But what that does mean is when you're applying to the AFP, you can say, oh, there's this job in plastics, for example, is why I applied. I knew that I wanted a bit more time to kind of try things out, get a bit of background of the specialty, have a bit more time to spend with a particular team if this was made possible with the kind of clinical time later down the line. It might just be that you have a regular job in it, as I have had in particular specialties. Not all your jobs bar one will be regular foundation jobs. So it might just be that you have an opportunity with one particular unit that you want to be with, and that is another way to kind of maximize your chances of spending time in the specialty you'd like to. And the last one is kind of what I've alluded to kind of more broadly. this is an opportunity to try out an academic career. This is a chance to work with clinical academics, and it's a chance to see what that job might be like, to try out the kind of earlier steps in that, maybe map out a research project that you'd like to design, maybe kind of see that through over a couple of years. It's an opportunity to decide, well, this is a taster for academia. Is this something that would appeal to me? And would I like a kind of career pathway that incorporates parts of that later down the line? And I'll go into a bit more detail later on. Again, why should I do it? There are particular things that will appeal to you. Well, may appeal, may not. By and large, these jobs are based around central teaching hospitals. The reason being is because they're partnered with universities. That's not the case with all the jobs you'd be applying to, but it's the case with the majority, and you'd be able to choose which jobs you want to rank most highly. So if you wanted to stay in Glasgow, for example, you'd have that opportunity to do that. You have a university kind of staff contract. You're normally some manner of kind of honorary academic. So there are opportunities. There are very broad opportunities based on that. And that is something that is kind of prestigious in and of itself, but it does give you a pathway to do other things that you might find interesting. I put in the third point here. I don't really want to be flippant and sort of suggest that these things aren't important, because they are. Your SJT is the exam that you'll do in final year, which gives you a point kind of ranking when you apply to your foundation jobs. AFP doesn't actually use that system. It uses your score based at interview and your portfolio. So if you have a bad time, and this isn't to say that this will happen to people, but it does happen that people have a bad time and they get a bad score on the day that maybe doesn't reflect their competency as a medical student or a doctor. But if that does happen, well, actually, this is maybe you're applying to 2 jobs instead of 1. And if you have a rough time on one of them, well, you might still be able to get the sort of job that you might like using the other system. And the same thing applies to the educational decile as well. You don't want to get too fixated on that as some marker of, will I be useful, or am I sort of suited to AFP? Because that's possibly a bit beside the point. The questions you should be asking yourself are, well, am I interested in academia? Do I have a passion for the sorts of things that I'd want to be doing? And maybe putting that idea of, actually, did my performance in university kind of support that to one side? Because that's a bit of a, it's maybe not everything about who you are as a person, let's put it that way. The protected research time is the fourth thing there. This will vary from place to place, but in some jobs, 4 months. So normally your jobs in FY1 and FY2 are these 4-month rotations in different departments that you rotate through. In certain places, so Dundee in particular, Edinburgh gives you the option to. I think the northern area, that sort of Aberdeen Inverness rotation I was talking about, gives you protected research time as well. That will be the case for lots of places in the UK. So it's worth having a look through their website to kind of see what the opportunities in particular places are. And the last 2 things here are, again, maybe opportunities that are available through the place that you're applying. There might be some funding for higher degrees, for sort of PG certs in, I know, medical education, for example. That's not the be all and end all of AFP, but it's a nice perk that sometimes exists in a few places. And the last thing here is, well, you'll be applying to jobs. You want to do a specialty that interests you, and I'm sure that will be possible for all of you, depending on that. Like, your career is going to be a long time, but it is something that has that you can talk about in terms of, these are the positives I got out of this program. It was hard to get in. Here's what I achieved, and all of that will stand you in good stead for applying to a training post. So the introduction to an academic career is kind of what I'm going to gloss over a little bit here, and we'll try and pick up in some of the sessions to come. There are career pathways in medicine that support academia. Doctors who work and do research at the same time, and how that works will depend on where you are in the country. In Scotland, there's this there's this kind of training pathway called Screds. You can look up all that information online, but it's a sort of, there's a range of opportunities, some of which come after specialty training that you get linked into academic opportunities. Certainly that's part of AFP, kind of comes under that broader kind of catch-all term for training. There are kind of clinical lectureships, things that you can take time out to do in terms of kind of higher degrees, doing your PhD, for example. It's a broad, nebulous area. There are lots of things that you can do, but AFP is a taster of that. You get to experience a bit of a sense of what that might be like and decide if that appeals. In England, that's slightly different. You have academic clinical fellows, for example, after you do your AFP years. Again, the structure of training might well change in the years to come, but the point is that there are pathways to do clinical and academic work together as you move through your career. The second point here is probably just as an important thing to highlight. AFP doesn't and probably shouldn't appeal to everyone. It's a very difficult, or it might be difficult going through FY1 and FY2. It's certainly a learning curve, and it's certainly different coming from university. And AFP is something that you can do in addition to foundation, but at the end of the day, you don't need to, and you don't need to add that stress on if you don't want to, if you don't need to, if that doesn't appeal to you, if that doesn't interest you. If you don't want to spend your evenings trying to write a paper, you absolutely do not have to, and vice versa. If you don't get a job in AFP and you still want to do AFP, you still want to do publications, you still want to get involved with research, you can also do that outside AFP. So don't worry too much about getting involved with AFP or feeling like that's the be all or end all. Certainly people have failed to get into AFP and done other things and then joined into academia later down the line because they knew that was something that interested them. Certainly, this is a taster, AFP. You can do AFP and decide, no, this doesn't appeal at all. I don't want to do this later down the line. So it's really an opportunity. It's not a requirement. The first thing there is a bit of a technical thing. If you have a partner, if you have a friend, if you have kind of caring responsibilities, other things that might affect your application to your foundation jobs, AFP doesn't allow you to link applications to someone else. So that's something you can do in the regular program where you can sort of say, I want to apply to work in the same area as my partner. We're going to link our applications. We apply with the same kind of minimum score that we've achieved between us. That's not something you can do in AFP. You have to apply separately. So if you wanted to stay in a particular place because that's where your life is and that's where the people you care about are, you might be able to do that, you might not. And certainly you can apply to both, but the ultimate decision might be affected by that and ultimately probably should. Rural and city is something that I mentioned a couple of times earlier. You might be based in a central teaching hospital. By and large, that's what the majority of these sorts of jobs are, because that's where the universities are, that's where some of the research opportunities are. That might not be what your kind of further career looks like. That might not be what you're interested in. If you want to work as a rural GP, I mean, why would you want to spend all your time in the city? If you wanted to have a mix of kind of district generals and central hospitals, you're going to have a different set of experiences, and there are lots of really interesting, valuable things that you're going to get out of rural placements that might not be possible in the city. I don't want to suggest that AFP is like the better option. It's just a different option. That's not a hard and fast rule. Certainly, the northern area in Scotland allows you to rotate around some really interesting rotations. So you get to work in some jobs in Fort William. You get to work in kind of different general hospitals, rotating through Scotland. You can work on the islands. I mean, there's it's not a hard and fast rule, but by and large, what I'm getting at is most of the jobs you'd be applying to would be a central job in a teaching hospital. So that might affect your choices. And the types of jobs on offer, if you want a particular specialty and that's not within your AFP options, well, you know, probably don't do AFP. That's a very, very valid choice. I had friends who applied to AFP who got offers. They didn't get offers in the specialty that they wanted, and actually it was a very sensible decision for them to sort of say, well no, actually I'm going to do the regular program. I'm going to do this job because that's what I want to do. I want to have a GP placement. I want to have a A&E placement, whatever it is. And again, you don't have to do AFP to do academic things that are interested. You can have both. So some things to consider there. What am I doing? I've kind of talked around what you can get out of AFP. I just wanted to kind of touch on some things that I got out of it over the last year. So I've got a research project in April. Obviously, none of that has happened yet. I've had a year as an FY1, which has been an interesting year to be an FY1. But some things that I got out of my time at Dundee, well, I put together a kind of teaching guide, a sort of a guide for acute scenarios called the Acute Care Guide that you might have seen if you're a Dundee medical undergraduate. It was kind of designed for FY1s. I'm not going to get into the details of it, but it was something that helped me become involved with different styles of medical education. There's something that I've been working on to help develop academic support programs and support people going into research together with the deanery here called the Academic Training Hub. DRAMS, the organisation who put on these events, are putting on these events, a conference later on this year, lots of other things that you can get involved with as an AFP student. DCAT is an organisation, that's the Dundee Clinical Academic Training Programme, something along those lines. That there's lots of opportunities to get involved with research training and things with TASC is another kind of local organisation that oversees medical research between the University of Dundee and Ninewell. So there's lots of different things going on there. There's some QI projects I've been involved with. There's some medical education work that I've been involved with. I'm getting some stats training later on this year, getting some research training, and just you can see for yourself there's a broad range of opportunities. The most important one, maybe not the most important one, but the thing that is worth highlighting is that I've got a research project and I have dedicated research time towards the end of the year. I've got 4 months to work on a really interesting clinical project, and that's a really valuable opportunity for me. And there's lots of other things that you can do to be involved with the University of Dundee as an AFP trainee here. All the things that I've talked about have equivalents across the UK, so it's worth looking at a range of training programs and seeing what's on offer. But what am I really doing? I'm doing the exact same thing as every other FY1 and FY2. I'm doing the job. I'm doing lots of service provision. I'm doing lots of really interesting and important training to become a doctor. And that's really what everyone who's going through the foundation program needs to get out of it. So it's worth just mentioning there. I'm trying to learn how to be a doctor. That's probably the most important thing. So what comes next? Well, for you, I just wanted to highlight these are the timetables that if you're in your final year, this will be the timescale for applying to AFP if that's something that still appeals. We'll have 2 lectures later on this month on building a portfolio that'll be part of the application for applying to AFP. We'll have a later session on the interview process itself. Both of those will be before the actual deadline for applying to AFP, and certainly after all of those applications have been put in, and if you find yourself in a position that you've been very fortunate to get an interview, I'm sure we can get some AFP trainees together to give you a bit of advice or to be a sounding board for you to kind of talk through your preparation if you'd like that, if that's something that appeals. The last thing, don't want to overwhelm you, but what would you need for applying? Need is the wrong word, because these are the max limits of what you can apply with. Higher degrees, publications, presentations, prizes, all of these things will support an application. I did not have the maximum criteria for all of these. I did not have a higher degree. I did not do an intercalated degree. I had a couple of publications, I had a couple of presentations, I had a couple of prizes. You shouldn't be overwhelmed by thinking that you need to have everything, but you need to start thinking about, well, what have I done? What can I do? And how can I use that to kind of sell myself? Because I'm sure all of you will have done interesting things that are worth talking about, and that might support you for applying. The white space questions are part of the application process itself. That are broad questions. You can read online, you can see if there's a particular area, what questions they're going to ask you. You can start thinking about what questions you'd like. So it's worth thinking about, what have I achieved? How will that support me in terms of the questions I'm going to be asked? What should you do? Well, this depends on where you are. If you're in your final year, then ultimately you just need to start thinking about what you've done and how to use that to sell yourself. You know, it's late on, and you just need to get, if you want to, get your head around applying. If you're earlier on in your career, then there are lots of fantastic opportunities. You can do interesting electives and SSCs. You could do a project. Certainly there are summer projects based at universities. Don't do that if you want to do something really fun and rewarding with your summer as well, but you can do projects at the same time as your degree. You know, it's not an either or. You can have your cake and eat it too. You can intercalate. You can intercalate at the University of Dundee. You can intercalate with other universities in the UK. That's something that's not necessarily always sold to people. You can join societies, go to conferences, and I'm sure DRAMS really want me to say, get involved with DRAMS, because they are a student society for students involved with research. They have a lot of fantastic guidance, a lot of fantastic opportunities for you over the coming years to get involved with research and decide if that's something that that appeals to you, that you'd like to use to sell yourself in applying. There are journal clubs online. And the last thing here is, well, actually, AFP is about interesting people and about interesting people with a range of skills, and it's not always the things that you might think about that are the things that you might benefit from when it comes to applying. I know some trainees who knew how to code, who because of that used to do really interesting projects based in kind of statistical programs that support really interesting areas of research like bioinformatics. Language, I mean, God, that's really adding on a load of extra workload. But actually, what I'm trying to get at is there are broader things around medicine that will be compelling for you as an individual applying to sort of say, these are the things that I can do. This is why I'm an interesting person who can work in a range of different environments and scenarios. God, if you knew how to speak French and you wanted to work with MSF and you wanted to talk about research that you'd like to do in that area, you'd be the most fascinating person on the interview. And the last thing as well is, well, I knew friends who actually the opportunities to teach might not exist as an undergraduate, but well, they knew how to teach swimming, and the fundamentals there of how do you actually engage with someone, how do you work out what their baseline of understanding is, how do you develop a teaching program for them. Those are very generic skills that you can actually talk about in terms of the capabilities, the opportunities that you've had in the past, the skill set that you have. So I don't want to say, you know, the only things that you can use to apply to AFP are this one paper that you wrote during your intercalated degree. It's a broad range of opportunities and interests and things that would help you to apply and to sell yourself. The last thing here is really just to sort of say, these are the lectures coming up this year, and I've prattled on for a little bit here, so I really just want to sort of say, put out the opportunity to ask any questions. I'll have a quick look through the chat now, but if you want to direct any questions towards DRAMS, we'll put out the email address, and I'm sure we can go over some of those in the sessions to come, or even put up some of that information if these are kind of recurring important questions on the DRAMS website. So if you see this as a recording, feel free to get engaged as well. All right, I'll just take you off the presentation here and hand back to Wan. Hi there. Do you have any questions for us?
Yeah. So there's one question asking if you're doing the research or education AFP.
So that's an interesting question. So in Dundee, you have I'm sorry, I'm just realised, am I blurred out? You may or may not be able to see my face. I don't know if that makes me a disembodied head when speaking in the background there. Well, Dundee has a range of different, they take 6 trainees, they have 2 different styles of training, and when you do your research program kind of correlates to, are you a research trainee, are you an education trainee, are you a medical leadership trainee? I'm a research trainee. Actually, I don't know that it's necessarily affected what I've done. I know that certainly they try and highlight some extra opportunities to you depending on your time of year. So if you were to do the first 4 months of the year, so September to December, as some of the trainees are doing at the moment, then that's a great time to get involved with teaching. Maybe slightly later on in the year, that's still good. Possibly overlaps with exams, so maybe that's better or worse. Mine, April to August, probably a pretty bad time to get involved with teaching, to be honest with you. But you know, there are still things that I can do. There's still things that I can do over the course of the year, and I wouldn't say it's necessarily limited what I've been able to do. But I would be aware that depending on what you're applying to, there might be specific opportunities. In the past, Dundee offered particular funding just to the medical education AFPs alone. That funding's actually gone away, unfortunately, but it's similar sorts of opportunities exist across the UK, so it's worth looking at the different foundation schools and seeing what's available. All right, any more questions?
There are no more questions in the chat, but I have a question. So you're doing a clinical project at the moment. What sort of different types of projects can people do on an AFP program?
So you can do anything and everything. I guess that is the point I'm trying to get across, is that actually AFP isn't necessarily a prescriptive thing where they sit you down and they sort of say, you're working with this person, you're working on this project, this is your timetable for the next 4 months. It is an opportunity to have some time to yourself, to decide what you want to do, to pick up projects that interest you, that you can reach out to different academic kind of leads in different areas and sort of say, I know that you're working on, well, for example, in my case, I'm working with an academic breast surgeon who was looking at was 2 sorts of projects. One was looking at self-reported outcome measures for breast reconstruction. That was a really interesting project that I got involved with to kind of look to see, are there groups of patients who have better outcomes than others? Are there patients who are kind of more dissatisfied? What are maybe the kind of reasons around that? Could we identify them earlier and maybe better support them? Doing that sort of there's a mix of kind of quantitative data there and qualitative data. you could design, the thing that I'm doing in my research project in April is a slightly different project looking at tissue biopsies, and actually looking at that kind of taken in relation to breast reconstruction again, and looking to sort of see if some features of the actual tissue sample itself, and this is kind of relating to elements of kind of neuro tissue density, but just sort of features of the biopsy that we can pick up. Does this have a kind of correlative measure that we can predict and kind of score alongside long-term outcomes? So actually, could you look at tissue biopsies taken at the time and sort of say, actually, these people might be more at risk of kind of long-term chronic pain issues relating from their surgery? Would we choose the anesthetic option that we would use in the immediate surgery differently based on that data? So would we use a local block, for example? And that's really just a highlight of one thing that I've done. That's just with my supervisor. There are lots of things that you can get involved with over the course of the year. My research block is that 4 months at the very end of FY2, but I've been here for a year. There are things in the department. There are things at a deanery level. There are things, you know, if you wanted to get involved with an organization that kind of relates to your specialty, so I don't know, orthopedics, plastics, whatever, there'll be national projects that are going on that you could be involved with as a local local unit. The fantastic thing that came out recently with Dundee is the TASC, TASC, Tayside Academic something centre, put out a lot of guidance about how to apply and actually create a research project from scratch. There's a lot of really interesting guidance that if you wanted to go to your interview and sort of said, I've got this interesting question, it's come up in what I've seen in clinical practice, I really want to develop this project that I have in mind. It would involve me looking at this group of patients, recording this data, doing X intervention. Here's how I plan to get funding. Here's what I plan to measure and kind of long term how I'm going to measure it. Here's how I'm going to approach the kind of ethical approvals around it. Well, if you did that as your foundation program, you would be incredibly impressive, and that would really set you up for doing things later down the line if you wanted to be involved with the NIHR, National Institute for Health Research, I think, if you wanted to get involved with the Wellcome Trust, doing the sorts of long-term projects that could actually set you up for a PhD is really what I'm getting at. So what I should say is you can do anything and everything as part of, well, maybe I shouldn't say that, but you can do a lot of things during AFP, and it's really what you make of it, I should say.
Thank you very much. There are just 2 more questions. So okay. Would it be possible to do a project which is more longitudinal and extend it beyond a 4-month protected research time?
Yeah, of course. So I have mixed feelings. I have mixed feelings about whether or not I chose the right time of the year to do my project, and I'm obviously biased, but I sort of say to myself that actually I probably got it right, having it right at the very end. And the reason why I say that is because it gave me, or is giving me, the full 2 years, or rather the full 20 months, I guess, to set up what I want to do during that 4-month time. Other people have had they've got their training, they've got their research project at the moment, actually, and they can do something. They've tried to plan for it over the course of the last year, and lots of them have really interesting things set up. But they might find that come the 4 months, delays have crept in somehow. Things took longer than they anticipated. They might, obviously, they'll be working in clinical environments, but they might be using the next 8 months to actually finish off projects, to involve other people in kind of looking after the project as it goes along. So say you want to take I know you start something in your project and you want data at 6 months and at a year. Well, you can set that project up to involve other people, other trainees, students. Like, lots of these projects are designed for undergraduate students to get involved with a project there that there's a bit of support around what you're doing there. And they'll be using that 8 months as well to actually write up the results of it. I mean, I've got 4 months to do a project. Chances are it might take me the 4 months to do it, which is fine. But the time to write it up, the time to present it, the time potentially to even turn it into a paper, will exceed beyond that, and kind of how that will fit into your plans over the course of the year is it's kind of an individual thing. Certainly you can stay around the area that you want to do your AFP in. I'm sure you can work in a clinical fellow capacity. You could work as a locum and just do that stuff in your own time. You can go into training and continue this project on. There are lots of different ways to do it, and yeah, really the world is your oyster is what I'm getting at.
So someone asked, as protected research time varies between deaneries and areas, do you know a good or useful resource or website to find out about specific details of each local program?
Yeah, of course. Do you mind switching me back to my slides for a second, and I'll show you the last couple of things. Can you see that? So I'm just going to take it on to further resources. So I've put some links in here. There is a link there to the UK Foundation Programme website. There's a lot of really interesting information there about the different areas, the actual application process, a bit about what you might be able to get out of AFP, and it links to lots of the actual like local areas. So it'll link to the DCAT guide, for example, the Dundee Clinical Academic Training website. There will be a similar website for for Glasgow and for Edinburgh and for the Aberdeen and Inverness one, all talking about the opportunities that are available there. There will be links to the rest of the foundation schools, all the academic foundation schools, and what might be available. And that's quite a good thing to get your head around, because if you go to an interview, your interviewers will be academics from those areas. They would like to know, and quite a recurring question is, well, why do you want to do AFP here, as in here in Scotland, here in, maybe not here in Edinburgh versus Dundee, because actually your interview is going to be for Scotland rather than a particular area. But it's worth saying, for example, there are opportunities in translational medicine at the University of Edinburgh. There are opportunities in precision medicine at these are broader concepts that you don't have to get into just now, but the point is, these are research interests that they want you to know about, they want you to be interested in, because they want you to get involved with it. So to be able to sort of say, well, I know there is, and this is an example that you don't have to know about, but there is a HDR UK centre based at Edinburgh. There's a bioinformatics unit that I think is really interesting, because I'd love to spend some time there, work on a project there, engage with this research that's already going on there. They would love you to know about that sort of information, and that would stand you in good stead. I put in Dundee website there for DRAMS, because I'm sure you've got lots of really interesting resources there about what you can achieve in AFP. I put a recommendation on the side there, which I don't want to make too big of a deal out of, because I don't want to be recommending people buy things, but certainly it's a book that I used and I found quite interesting for getting my head around an interview process and an interview in medicine, and that talks a little bit around what you can get out of AFP, what you might like to approach in terms of I'm going to do this research project, for example. It's available on Amazon. I'm not getting any any money back for telling you about it, but maybe see if a friend has a copy, for example, if you can see if you can scrounge it. But it's on Amazon as a worst case scenario. There's the link to DCAT. There's the link to Screds, is the organisation who kind of oversee academic training in Scotland. I put down the Academic Training Hub, which is something I've been working on in kind of coordinating research and academic opportunities at Dundee. It's predominantly for academic trainees, but you might get something useful out of reading it. Certainly, there's a bit of talk there about about clinical research centres at the University of Dundee. So there's some background detail that you might find helpful. I think that's the last slide, but further resources. I'd really look at university websites, the universities that an area is linked to. I'd look to training programs. It might be worth looking at, like Screds, for example. It might be worth having a look at even organizations like the Wellcome Trust, NIHR, the sorts of research institutes that you might want to be able to just sort of, you don't have to talk about it like you're an expert, but sort of you can allude to having a familiarity with these sorts of things, because it shows you're engaged. It shows you're interested in the opportunities. And I think the last thing that I put down there is talk to your friends, talk to people who have applied to AFP, talk to people who've done it in the past, talk to people who are applying with you, because you'll be able to find useful things out from each other. And certainly, I'm sure we'd all be happy to help you. We've all gone through that same interview process. It can be very, very intimidating, and we don't want that to be a barrier to talented, interested people getting involved. I'm going to say, don't pay for a course, because I don't want to encourage that sort of thing, but maybe find a nice friend who's gone for it and cook them dinner. That's what I did after getting some lovely advice from an academic FY. But this is from people you know. I don't want to have any unsolicited dinner invitations, especially not during this time. Any other questions?
Great. No, I think that's it. I just want to say a few words. Thank you so much for taking time to do this talk and also arranging the whole series. I think what you said was very beneficial. Certainly students who consider an academic career might not think about the wider picture sometimes. And, so I found that really, really interesting, and yeah, opened my mind a bit more. So thank you so much. And I think we'll put your Padlet page up, so if any other students want to ask any questions about the academic program, they can do so, and then I suppose you can see that and reply.
Sounds great. No expiry date on these things. Keep questions out. I'm sure you can send emails to Drams or even to myself if I put the details up. More than happy to reply, because it's just one of those things you've got to get through if that's something that appeals.
Okay. Could I just ask everyone to fill in the feedback form as well before you go? And thank you very much, everyone, for attending. Okay.
No worries. All right, I'll leave you in peace. Take care.